Hello everyone and welcome to this Western Victorian Careers Expo webinar, and in particular to this presentation of careers in the health industry. I'm Peter Miller, your discussion leader for the next 30 minutes, and I'm the Communications Manager at Wimmera Health Care Group. I'd like to start by acknowledging the traditional owners on all the different Aboriginal countries each of us is videoing in from today, and pay my respects to their elders past and present, and to any Aboriginal people present here today. Your panel for today includes Acting HR Manager at Wimmera Health Care Group, Sophie Connor, Training Officer and Careers Advisor at Western Health Service, Jessica Pilgrim, and from East Grampians Health Services, we have Registered Nurse Lucy Mills on the right, and Personal Care Healthcare Worker, Melanie Sporton as well. Just a bit of background on these panellists before we start. Sophie Connor stepped in at the last minute today to fill the shoes of HR Manager Glenn Hines, so we appreciate that, Sophie. She's from Horsham and went to Horsham College before completing a Bachelor of Commerce at University of Ballarat, majoring in Human Resources. She worked for 3 years in HR with Ballarat Health Services and joined Wimmera Health Care Group in 2015. And after further study, Sophie is now a certified HR practitioner. Jessica Pilgrim started at Wimmera Health during a gap year in 2014 as a catering and general services assistant, and continued in a casual role while on holidays from university. She left university and returned to her old job doing a traineeship in administration services while completing a certificate in business, and that has led to her current role. Lucy Mills has always been an Ararat girl, and she completed her nurse training in Ballarat. And during the majority of the COVID-19 pandemic, Lucy worked in urgent care, and she would have dealt with many patients suspected of carrying the coronavirus. So thank you for that, Lucy. And Melanie Sporton is also with East Grampians Health Service, and she's completed a school-based apprenticeship, and she's working as a healthcare worker in her second year of her diploma. I hope I've got that right, Melanie. Okay. A big welcome also to all our panellists and to everyone participating in this presentation. And don't forget, you can post your questions during the webinar, and we'll get to as many of those as possible. So Sophie, we might start with you if that's okay, from Wimmera Health Care Group. Why should young people consider a career in the health industry, and what are the local opportunities for them?
Yeah, sure. Thanks, Peter. So young people considering a career in health, I think, first of all, there's a diverse range of opportunities in healthcare and career advancement, and that might be vertical, but also horizontally into other positions or specialties or professions even. Healthcare, if it's the hospital, it's generally the biggest employer in each town or city sometimes. So there's generally a lot of learning opportunities that come with that. For people that want to help people or make a difference, give back to their community, people get job satisfaction from working in healthcare. It is a industry with a lot of constant change and challenges, which make it quite an interesting field to be in. And it's also quite a stable industry to be in. Healthcare is always needed, and particularly at a time like now, you can see that it is quite an essential industry to be in. And just for people that work in the health industry, there generally is quite good pay and benefits with leave and different things, and flexibility, support to study in the health area. So yeah, in terms of why the health industry, I'd say they're the key things that come to mind for me. Local opportunities, so looking at Wimmera Health Care Group, we have a number of opportunities in medical, nursing, which includes a lot of specialties within that, allied health professionals like physios, dietitists, speech pathologists, those sorts of areas, and then also in corporate. So that includes your admin, food services, cleaners, engineering, OH&S. There's a lot of support services that help the hospital run. So there's quite a broad range of different positions that come up from time to time. Probably our more difficult ones to recruit are those that are sort of in national shortage as well, which is your medical, nursing in particular, and midwifery and crit care, physios, and pharmacists can also be tricky.
Okay, thanks for that, Sophie. Jessica from West Wimmera Health Services, sorry. Do you feel that moving away for study presents a barrier to entering the health industry?
No, not at all, Peter. I think that me personally moving away to study, and it's the same for a lot of others, it doesn't prevent you from entering the health industry at all. I went away with some great contacts from Western Victorian Health Service in my study field, and they were a big support to me while I was at university. And then we even looked at, when I had to go on placement and things like that, we looked at me returning to my hometown to our local health service. So if you can build partnerships between universities and healthcare facilities whilst you're studying, you have a greater chance of entering the health industry when you return home, or if you want to go elsewhere. Yeah, as long as you're open-minded and have good communication, it shouldn't prevent you from it at all.
And I guess that foot in the door after school is a good way to start too.
It is a very good way to start.
Yeah, fair enough. Now, Lucy, what was your pathway into the health industry, and did you always know that that's what you wanted to do?
So no, not really. I never thought that I would be a nurse ever. I finished school and I didn't really know what I wanted to do or what career I wanted to study in. So I had a gap year and I worked at the vet clinic here in Ararat as a vet nurse. And whilst working there, that made me want to become a nurse for people, actually. A bit different. And then I sort of went on to applying to unis to get into nursing for the year after my gap year. And I got into Ballarat, which was really good. I was able to come home on weekends, play sport, still see all my friends while still going to uni during the week. So that was really good, and it's probably surprised me that I wanted to be a nurse, but I'm really glad that I have chosen that pathway for my career, and I'm really enjoying it.
You have a lot of friends that have said the same thing, like in the industry? A lot of nurse friends?
Yeah, lots of friends that have become nurses. I think a lot of them wanted to be a nurse for a long time, so they knew what they wanted to do, but I just sort of wasn't sure from the start, and having the gap year was probably a good thing for me.
Great. And Melanie, you started your career with a school-based traineeship. How did you balance school, study and work? And what happened after you finished your school-based apprenticeship?
Yeah, so in year 11, I was offered the school-based apprenticeship here at East Grampians Health Service down at Garden View Court, which was a low-level hostel. And I did a Cert 3 in individual support. I was there 2 days a week and at school the rest of the days, and I was here 1 day a week. It was hard, but it was great to be in, I was in BCAL, so it was great to have not time management. So it wasn't like expected to have work done at a certain time, so I would just cruise along with it. I'd focus more on my study more than schoolwork and get it done, and it was a breeze, but difficult at the same time.
A few extra hours? Yeah, that's good. And Jessica, if I could get back to you, what is Wimmera what is West Wimmera Health Service doing to help young people start their career in the health industry?
Thanks, Peter. At the moment, we offer a lot of work experience placements. VCAL placements, you know, just trying to give the students the best opportunity to figure out what they would like to do and perhaps what they wouldn't like to do. And just, yeah, giving them the experience and using those communication skills on a foundational basis, observing what does happen in the workplace and, you know, experiencing that the actual work time being, you know, 8:30 till 5 o'clock in the evening. And we do a lot of talks with our local secondary schools, let them know what we have to offer. We're looking at doing an industry open day here at Western Victorian Health Service, and COVID-19's put a bit of a spin on that, but we were hoping to get all the students to come and visit and have a look around and see our current students on work experience and VCAL placements, and get their feedback and get them to talk to prospective students about their experiences, so things like that. And my role as a training officer career advisor, I'm always here to talk to anyone who has an interest in the health field and, yeah, see what pathways they might like to go down and what supports they might need, sort of like a mentor.
And work experience, a good way to get started with that as well, Jessica, like just for an introduction?
Absolutely. Generally in school holidays, students are supposed to set up their work experience, and I say the more you do, the better off you'll be. It's a sort of process of elimination. And yeah, you'll soon figure out what you would like to do and perhaps what isn't in your interests. So yeah.
Okay. And Sophie, this is probably a question you or Jessica could answer. Are there any opportunities for students to do some work placements in the allied health sector?
Yeah, there sure is, Peter. So we have students across all of our allied health disciplines. They have multiple students every year. So we have their students from universities that are doing that course. We also have work experience as well that sort of give people insight to mental health as well.
Okay. And just while I've got you there, looking at Wimmera Health Care Group, how big is the actual workforce there? And is there a particular shortage in workers in any particular areas?
Yeah, so we have just over 1,000 employees here at Wimmera Health Care Group. That includes the Horsham campus, where the majority is based, and we have about 200 or so at our Dimboola campus, which is half an hour away. And in terms of shortage, the ones that I touched on before, so medical, which is our doctors, in nursing, midwives, which is a little bit of further study. It can be a double degree or do a postgrad once people start here. We have a shortage of those, and critical care, which can be in our ICU or ED. That's sort of, again, another bit of a specialty area in nursing, but nurses in general can be difficult to have enough at certain times. Physiotherapists in allied health, they are difficult to have large numbers of applications and retain for long periods, so there's generally lots of options there. And in some of our other allied health areas as well, when we don't have the opportunities as regularly, but podiatrists can be difficult sometimes, and our OTs and speech therapists. Pharmacists are also a difficult one to recruit to. So, and that's sort of not so much unique from what the understanding I have, is not really unique to us. That is also sort of across the region. So if there's those sorts of areas that are of interest to you, I think you would find there's plenty of open doors.
Fair enough, yeah. Now, Lucy, Lucy's a registered nurse for those who've just tuned in. Lucy, can you tell us, just give us an idea what an average day for a registered nurse looks like at East Grampians Health Service?
Okay, so shift work, obviously. Morning shift starts off at 7 in the morning, and and afternoon starts at 1, but generally you'll go in and have your handover with this previous shift, and they'll give you a rundown of all the patients that are in, what's happening for the day, and the patients that you will be allocated. And after that handover, you'll sort of go out, start a plan for the day, and you'll go and start caring for your patients. So generally we start off with a medication round, getting everyone right for breakfast, getting them set up for the day, observations, those sort of things. Then start looking at showering, people that need help with anything during the morning. And then as the day sort of goes on, depending what is happening that day, we might be getting theatre patients back now that theatres are up and running. Generally, we have theatre patients come back to our ward at our every day. So that sort of requires a bit more closely monitoring for those patients with their observations and things like that, their recovery. So most days, well, lately I found that I've had a theatre patient every day in my group of patients, which is great. And then in between all that, we have our morning tea and our lunch breaks, generally before the afternoon stuff come on at 1 o'clock. They do sort of a group huddle handover, and then we go and do a bedside handover with the nurses that take over from us. And that can take around 10 to 15 minutes for all your patients. And during that double staff time is where we might get things done that require a few more hands just to help with work to make it a bit easier. And then the morning shift finished at 3:30. That's sort of what a morning can look like, sometimes a bit different depending on what's going on during the day.
Okay, and I guess the different alters much during the between the departments, does it at all?
Yeah, so urgent care is a little bit different. There's not necessarily always patients staying there overnight or in there when you come on in the morning. It's also looking a little bit different now with COVID. That sort of changed everything in regards to nursing and urgent care and emergency departments. So it can get a bit busy with dealing with things like that, including the swabbing and all that kind of stuff. Paperwork's changed. It just adds a little bit more. I know we're always sort of conscious of that now. A lot of things around COVID, so it has changed nursing a little bit, but most things are relatively the same.
It's about making you safe as well, isn't it?
Yeah.
That's right. Melanie, so what would you say are the 5 key skills or attributes for someone working in your line of work?
I guess main skills really need to be caring. Yeah, caring, have a lot of empathy for everyone, not just the one person. I'm in a facility, so there's 24 other residents there. You need to respect everyone. You also need to have really good communication skills. If you don't have communication skills, there's really no point. You work with everyone, and a passion for what you do. It is a very rewarding job.
Great. Thanks, Melanie. And Jessica, you're a non-clinical worker, of course. What does this mean, and why are there non-clinical workers, and why are non-clinical workers essential to the health industry?
So non-clinical workers encompasses everything aside from the medical doctors, the nurses, and things like that. Being non-clinical, we are still an essential service. We cover everything from administration, finance, business and strategy, cleaning, working in the kitchen, all of that sort of thing. And my role is education and training. So without all of that, a health service can't really run, especially without our beautiful cleaners and chefs and those sort of things. You know, we all gel together, and it's how a good health service runs. So without one or the other, it's a bit difficult. So yeah.
Fair enough. Sophie, if I could just get back to you, what would you say to a young person who is thinking about a career in the health industry, and where can a young person go for more information on health careers?
I would say, first of all, there's a number of opportunities. So for unqualified, TAFE qualified and university qualified positions. And there's a lot of different pathways to go into the position that you want, or if you are not sure what you want, but you know you want to work in the healthcare industry in a certain profession, you could start off with a broader degree and then specialise later, or you could do, you know, if you're doing work there after school to get an insight of what it's like working in the healthcare industry, or do a TAFE course first and then go on to do further study. I would say it's a very rewarding area to work in, but also not to stress if you don't get the ATAR you wanted, or you're not 100% sure on where you want to go. There's lots of opportunities to, you know, go as a mature age student, or you know, specialise a bit later. So I would say have a think about what you want to do. If you want a bit more information, there's things like My Health Career that has information on a broad range of careers in the health industry. Same as places like Open University has descriptions and links to specific professional websites that you can get a bit more. You can also have a look at, even on Seek and things, what positions are being advertised, and look at their position description. Talk to someone you know. If you know someone's a nurse, or someone's working in allied health and you think that might be industry, ask them, you know, what's it like? What did you do? How did you get into it? But also, for example, Wimmera Health Care Group, we have a recruitment website that we advertise all our jobs through. So if you go onto our website and then under employment and positions vacant, you can sign up there and you can register for alerts. So if there's a particular area that you want to get notified when jobs come up in those particular categories, you can select those in advance and it'll email you when, as soon as a position comes up, so you don't miss it. So with other health services, with recruitment websites, that's generally a function. So yeah, that would be my tip.
Okay, well, I've got you there, Sophie. One of our students has asked about enrolling to look after children in particular. Can you get a job where you're looking after children in the hospital and maybe do an apprenticeship to look after children, or is it necessary? Do you have to look after all ages?
I would say probably in, if you're doing midwifery, you'd be looking after babies, but also that's probably where more of our kids go. In saying that, particularly being a bit more, the more sort of regional or rural you start to go, the less you have units that specialise in just one particular area. So we also have adults sometimes that go into that kind of ward. So that would be the closest I would say that would be sort of mainly purely working with kids. There is involvement with kids and even, for example, like speech pathology and things like that. They work with younger kids and their parents and with speech difficulties in that particular example. But yeah, there is aged care specific, where we have our residential aged care, but a lot of our other wards have adults and yeah, sometimes younger children.
Okay, thank you. Lucy, you might be able to answer this for me. Does your particular role, is there any issues with mental health for the nurses themselves? Like, do you have any issues that way?
For nurses, do you mean? Or
Yeah.
yeah.
Do you find nursing? Do you find it sort of stressful that way?
Yes, it can be stressful. I think there is a lot of pressure on nurses when you are at work, but I think sometimes the best thing to do is have debrief sessions with the people that you are working with and just go over the day, what's happened, how you felt about it, things that can help to push past those barriers if you have any, or if you're worried at all. And there's always people that you can talk to if you are struggling or having any problems that you might need a little bit of help with. I think there's always, yeah, as I said, there's always support there if needed. It's probably a little bit about sort of,
I think most health services provide free counselling services as well, don't they? Yeah.
Yeah. So yeah, I think there's always support here for us nurses if we do need it.
Great. And Jessica, I might field this question to you. What are the most looked at jobs in the healthcare industry? The jobs that people are interested in most?
Well, in my experience, Peter, I think, you know, in terms of the students that we have coming through for work experience and placements and tertiary placements, a lot of them are nursing or allied health. But as Sophie said earlier, we're still having trouble recruiting allied health professionals in certain areas such as physios and OTs. But they are certainly looked at in that sense. Yeah, I think, yeah, they're the jobs that most people tend to start looking at in the healthcare field.
Thank you. And back to you, Sophie. Paramedicine jobs in the Wimmera, is there opportunities in the hospital, or are they mainly through Ambulance Victoria?
They are through Ambulance Victoria for paramedics, yeah.
Yep. So
although we do have some people that have done like a double degree and done paramedics and nursing, and sometimes work in our emergency department. We've had a few of those, but for paramedic jobs specifically, that's through Ambulance Victoria.
So a nurse can take on a paramedicine
if they've done a double degree, so it's its own sort of qualification.
And what different type of nursing jobs are there available?
Nursing is a pretty broad field. There are a lot of, nursing makes up about 500 odd staff of ours. So within that, there's the nurses that work on the wards and in the different wards. So as I said before, the crit care staff work in ICU and ED, and then we've got our general medical surgical ward, our theatre, our maternity, paediatrics and general ward, and rehab ward, so as well as residential aged care. So there's those sort of areas, and then beyond that you've got other sort of more specific roles like nurse educators that help with the students and grads, nurse unit managers and directors and so on. So there's quite a few individual roles and like I said, sort of career paths in nursing to go either into a sort of different role or you know, vertically.
Okay, and just a quick one too. Do we have, what sort of facilities are available at the hospitals where students that are doing study without leave get to work with?
Can you repeat that?
Is it study without leave? SWL, I'm assuming that's what it stands for.
Well, in terms of supporting people that are studying,
yeah.
This is what you're about. So
just
under all of ours, there's study leave, which is paid, and if it's relevant to the area, then we certainly look at that. And also, yeah, I guess that's looking at without pay. That's also an option too if there was something different.
Okay, thanks. We better wrap it up. Look, just thanks to all the panelists that got involved. If anyone wants to stay on, there's a webinar on allied health services the Wimmera Health Care Group is hosting, and just like to thank Wimmera Southern Mallee LLEN for making this happen, and our moderator Vanessa O'Loughlin, who's been getting through all the questions. Hope you all got something out of it, and good luck with your career choices. And thank you again to all our panelists, to Jessica, Melanie, Lucy, and Sophie. Thank you.